Hello, today we'll be discussing lesions of the extraocular motor nerves and nuclei. We will take a look at three lesions. A lesion to the abducens nerve in the periphery, a lesion to the medial longitudinal fasciculus, and a lesion to the abducens nucleus in the pons and the PPRF. First, we will discuss a lesion to the abducens nerve in the periphery. Since the abducens nerve innervates the lateral rectus muscles, a lesion on the left will affect the left eye. The left eye will no longer be able to abduct to the affected side, but adduction will not be affected.
To demonstrate a lesion to the left abducens nerve in the periphery, I'm going to show you and demonstrate on the patient here. As you can see, when I have the patient follow my pen to the right, both eyes can follow. But if I take the pen back to the left, only the right eye can follow because the left cannot abduct.
I hope you noticed the medial strabismus in the previous demonstration. Next, we will talk about a lesion to the MLF. The MLF, as you recall, connects the PPRF to the oculomotor nucleus. If you have a lesion to the MLF, you will affect cranial nerve 3. Cranial nerve 3 controls the medial rectus muscles. Therefore, if you have a lesion to the left MLF, you will lose function of the ipsilateral left medial rectus muscle. Therefore, the patient will be able to abduct to the ipsilateral side. However, adducting will not be a possibility.
Now I'm going to demonstrate what a lesion to the MLF looks like clinically. Once again, have patient Dr. House here. I'm going to have patient Dr. House look to the left. As you can see, both eyes can follow the pen movement. Now as I bring it back the other way, notice that his left eye can no longer follow, and his right eye exhibits some right beating nystagmus. We call this internuclear ophthalmoplasia.
For our final lesion, we will discuss what happens when you have a lesion to the nucleus of abducens nerve in the pons. As you remember, the abducens nucleus is close to the ipsilateral MLF and PPRF. Therefore, if you lesion the nucleus, you'll affect the ipsilateral abducens nerve, the ipsilateral cranial nerve 3, and also the contralateral cranial nerve 3 through the ipsilateral PPRF. As a result, the ipsilateral eye will not be able to either abduct or adduct, and the contralateral eye will be left with only lateral rectus function. This is called 1.5 syndrome. It's a combination of the internuclear ophthalmoplasia that we discussed previously and the inability to gaze to the side of the lesion with either eye.
Okay, finally, let's see how 1.5 syndrome looks clinically. As we've done previously, I'm going to start by moving the pen to the patient's left. As you notice, neither eye can follow because the left eye is immobilized and the right eye cannot adduct. Now as I bring the pen back towards the patient's right eye can follow, but once again the patient's left eye is immobilized. This is a classic presentation of 1.5 syndrome.
Thank you, Dr. House, for your participation.
Bye.